For the veins draining the lower limb, we have two groups. We have a superficial group, which is seen on the right leg in this photo, and we have a deep group, which is seen on the left leg. Now, starting with the superficial group, we have the small saphenous vein, the great saphenous vein, and they both originate from the dorsal venous network. So in this photo, we can see the origins more clearly. The great saphenous vein originates from the medial side of the dorsal venous arch, and it ascends up the leg on the anteromedial side. The small saphenous vein originates from the lateral side of the dorsal venous arch, and it goes posterior to the lateral malleolus and ascends up the leg on the posterior side. So coming back to this photo, we can see the course of these two veins up the leg and thighs clearly. So we can see, as we said, the great saphenous vein. It's originating from the medial side of the dorsal venous arch. It ascends anteromedially up the leg, and then it goes posterior to the to the medial condyle of the tibia, and then again goes to the anterior side of the thigh so that it can enter the saphenous opening and then drain into the femoral vein. However, for the small saphenous vein, we said it goes behind the lateral malleolus, goes to the posterior aspect of the leg, and it goes up towards the popliteal fossa, where it forms part of the roof of the popliteal fossa, and then penetrates the deep fascia to drain into the popliteal vein, which is a deep vein. Here we can see the great saphenous vein going through the saphenous opening and then draining into the femoral vein. This opening is just below the inguinal ligament, and it's lateral to the pubic tubercle. Moving to the deep group of veins in the lower limb. Now the deep veins, they generally follow their corresponding artery, so there's going to be lots of similarities. So starting from the bottom and then ascending upwards, we have the anterior and posterior tibial veins. The anterior tibial vein drains the anterior compartment of the leg. The posterior tibial vein drains the posterior compartment of the leg. Now both these veins, they connect to drain into the popliteal vein or form the popliteal vein. This happens in the popliteal fossa. The popliteal vein then ascends upwards, passes through the adductor canal, which we will see later, and becomes the femoral vein. So here we can see the popliteal fossa. We have the popliteal vein, and we can see that the small saphenous vein is draining into the popliteal vein. Now it's important to note the anterior and posterior tibial veins are the terminal branches of the popliteal vein, whereas the small saphenous vein is not a terminal branch, and instead it just drains into this popliteal vein. So here we can see the adductor canal, and this photo is in an anterior view or an anteromedial view, and the popliteal vein would come from the back, from the posterior aspect, go through this adductor canal and become the femoral vein as it continues through the femoral triangle. Now for the femoral vein, it's the main deep vein of the thigh, and it enters the thigh by passing through the adductor hiatus, as we mentioned, as a continuation of the popliteal vein, and it lies medial to the femoral artery within the femoral triangle. It leaves the thigh by passing behind the inguinal ligament and continues as the external iliac vein, which then drains into or becomes the common iliac vein. So here we can see the femoral vein, and we can see that it lies medial to the femoral artery within the femoral triangle. As for the tributaries of the femoral vein, so all the veins that drain into the femoral vein, we have firstly the great saphenous vein, we have the profunda femoris, and we have both a lateral and a medial circumflex femoral vein. We also have two muscular branches in the more distal part of the vein. And then there's three veins that indirectly drain into the femoral vein. So they first drain into the great saphenous, and then that ultimately drains into the femoral. We have the superficial circumflex, the superficial epigastric, and the superficial external pudendal vein. Now for the plantar venous arch, it follows the plantar arterial arch. So the plantar venous arch, it feeds into the posterior tibial vein through the lateral plantar vein and the medial plantar vein. So as a summary, we can start with the anterior view, and this time we can go from top to bottom, starting with the common iliac vein. This is going to give us two branches, the internal iliac and the external iliac vein. The external iliac vein, as it passes behind the inguinal ligament, it's going to give us the femoral vein, and the femoral vein gives us many branches, some of which are the deep femoral, the femoral circumflex branches, and then we also have the great saphenous. Now the great saphenous vein is going to continue on the anteromedial side of the thigh and the leg. It goes posterior just only behind the medial condyle of the tibia, and then goes back to the anterior side of the leg, and it goes into the dorsal venous arch on the medial side, anterior to the medial malleolus. Now the femoral vein itself, it's going to pass through the adductor canal, and it's going to enter the popliteal fossa and become the popliteal vein. The popliteal vein at the distal part of the distal border of the popliteus muscle is going to give rise to two terminal branches, which are the anterior and the posterior tibial veins. We also have the small saphenous vein, or the short saphenous vein, which drains into the popliteal vein, and that continues on the posterior side of the leg and enters the dorsal venous arch from the lateral side. We also have a fibular vein, which just follows the course of the fibular artery behind or posterior to the fibula. Then we have digital veins, so dorsal digital veins. These arise from the dorsal venous arch, and we have obturator veins, internal pudendal. We have internal and external gluteal veins. These are within the greater obturator foramen. The pudendal vessels specifically pass through the greater obturator foramen to enter the gluteal region, and then they enter back into the pelvis through the lesser obturator foramen. Here we can see the internal pudendal vessel, internal pudendal vein, entering the gluteal region through the greater obturator foramen, and then it goes back into the pelvis or to the anterior part through the lesser obturator foramen. Now in the posterior view, we've mentioned all of these veins except the plantar. So we have the plantar venous arch, and we said it drains into the posterior tibial vein through the lateral plantar and the medial plantar veins.